Okay. Good evening, class. Today we're going to talk about. Can you double check my face in there?
Wait, did you press record?
Record.
Yes.
Yes. Record. There you go. Thank you so much. So this will be our teach back for this week, week 2 for Path 370, our Tuesday class. You were supposed to read chapters 1, 2, 4, and 7, right? Chapter 1 deals with Introduction to Pathophysiology. In this class, our goal is to be able to fully understand the word pathophysiology. What exactly do you mean by that? What is pathology? The study of human diseases, right? Which includes determining the cause of the disease. What is another word for cause of the disease? Etiology, right? In my medical profession, when I used to practice before I came here, we always look at the chief complaint of the patient. We always look at the history of present illness, past medical history, and we do a physical exam. When we do a chief complaint, we always ask, why did this patient come to the emergency room, right? So example, if you go there with, I can't breathe, I can't breathe, I can't breathe. That's a chief complaint. Most people come to the emergency room because of either chest pain, they can't breathe, or something that they develop like a seizure perhaps, right? Okay. So let's say you are faced with a 70-year-old male patient who has been coughing or productive cough of yellow-green phlegm, right? Yellow-green phlegm of 1 week duration, and 2 days before the admission, the patient developed high-grade fever, and then 2 hours before admission suddenly developed respiratory distress, or what we call shortness of breath. Came to the ER, you were the nurse on duty. What do you think is this problem? What is the problem with this patient? Who said pneumonia? And what exactly is pneumonia?
The inflammation of the lungs.
Inflammation of the lung. Or you want to be more specific than that. Is it infection of the lung, right? So you have a patient who's 70-year-old who is having productive cough of yellow-green phlegm, fever, and difficulty of breathing. Could this be pneumonia or an infection of the lung? Yes, right? So we are in the medical field. Are we going to consider urinary tract infection here? No. Are we going to consider other conditions that does not affect the lung? Of course, we think of the lung. Why? Because the patient came in with difficulty of what? Breathing. And when you breathe, you make use of your what? The lung together with the diaphragm and the muscles for breathing. Is that correct? Yes. Okay. The point, therefore, is that ultimately the doctor will make the diagnosis, but you are in the forefront. You will be the one to first see the patient, right? So when this patient is seen by you, you tell Dr. Gama, we have a 70-year-old male patient with chief complaint of shortness of breath, 1 week duration, a productive cough of yellow-green phlegm, 1 day before admission developed fever, high-grade fever, and in a few hours developed respiratory distress. So, I examine the patient, I get the history. Would I be important for me to get the past medical history of this patient? Is this patient hypertensive? Does this patient have any form of heart disease? Right? Did he suffer from heart failure in the past? Is he diabetic? Will this affect our treatment plan if he has these other conditions? Of course, because we have to treat the other conditions that could be seen in this patient. Right? Do you understand? Now, we rely on diagnostic tests, right? What do you think would be an important diagnostic test I need to perform in this patient? Chest X-ray. Now, remember we said the word etiology, right? Etiology is knowing the cause of the disease. Are we interested in knowing whether this infection is pneumonia of the lung? Can a chest X-ray help?
Yes.
No.
Yes or no?
Not just X-ray.
Can a chest X-ray help diagnose a patient with pneumonia? Who says yes?
It could help.
Raise your hand if you say yes. Don't be afraid. Okay. Higher. Why are you?
In addition to what?
Okay. Who says it is not going to help us? Okay. Okay. The answer: it will help us. Okay. That's why I'm going to order a stat chest X-ray. Okay. Chest PA. Why? Because when you do a chest X-ray, you can see lesions consistent with pneumonic, what we call infiltrates. So what would appear as a normal lung, compare that with a lung with pneumonia, you can tell. Okay? But what do you think would be the best test that I need to do in order for this patient to be diagnosed, in order to establish, is this a bacterial infection or a viral infection?
Culture.
What?
Culture.
Culture of what?
Mucus.
Yes? Sputum. Okay. Why sputum?
Because we can see, after lab test, we can see what is there.
Why would you consider a sputum exam?
Because it's an inflammation of the,
You want to
Okay,
see
when
the
you
infection.
Where do you get, okay, so
sputum is coming from the lungs.
from the lungs, okay, very good. So are we gonna get a stool exam?
No.
Urine exam? Or urinalysis? The answer is correct, sputum. Okay, I told the nurse I want a sputum, what exam will I do? Culture and sensitivity test. You have taken microbiology, I presume, right?
Yes.
Okay. So what specimen are we going to collect? The sputum specimen, okay? So, how do you get the sputum specimen? Yes, you, my dear. Yes, you.
By taking a,
Taking a what?
what's that name of the thing?
Swab?
Yeah, swab. So
Okay, very good. Your answer is correct, swab, but the answer is wrong. When you do a swab, I hope you don't mind. I'm just trying to make sure. I'm not trying to humiliate you. When you put a swab in the mouth, what organ are you testing? The mouth or the lung?
the mouth. Oh,
So
sorry.
do you think your answer is correct?
No.
There you go. That's called critical thinking. That is how you pass the exam, right? So can a swab of the mouth be the correct answer to my question? You see what I mean?
Yeah.
What is critical thinking? It's called common sense thinking. What is common sense thinking? First, what organ is involved? The lung. If you put a throat swab in the mouth, what organ are you testing? The mouth. You must be wrong. Right? I'm not trying to put you in
Oh
the
no,
spot.
thank you. It's helpful.
Yes, to help you understand that.
Connect dots. Yeah.
You want to change your answer, or somebody would like to give me another answer? How do you get? Yes, Maddie.
Would you use the phlegm? Like have them cough,
What?
have them cough up the phlegm and
Okay, so you're the nurse. Are you going to demonstrate that to your patient? Huh? Yes or no?
no.
Yes.
Okay, I'll give you an example. You go to the, what's your name?
Aaron.
Erica?
Aaron.
Erin. Hi, my name is Nurse Erin. Dr. Gamo ordered a sputum examination. Here is the specimen container. What kind? Clean or sterile?
Sterile.
Sterile. You leave the patient because you said, I will not show him. You go to the nurse's station. After 5 minutes, where is the specimen? You get the specimen. What did you give instructions to the patient?
No.
You did not. What is wrong with that?
They don't know what to do.
Huh?
They wouldn't know what to do.
Exactly. So what do you think will they do? Look at me, Aaron.
They probably
I'm the patient. What did I do, Aaron?
Spit.
And when you spit, what specimen are you going to get?
Saliva.
The what?
Saliva.
The what?
Saliva.
The what?
From the mouth.
What?
Saliva.
The what?
Oh, I know.
Shh, wait. Relax. Your turn has been out. Exactly. Did Dr. Gamo order a saliva CS or sputum CS? Exactly. You gave me the right answer, but the way to get the sputum specimen was wrong. You see what I mean? Some of you come up with the right answer, but you do not understand how, where, when, how, why.
Wait.
Okay, yes, I'll give you a chance to speak.
Do you go with the thing you put up the nose, nostrils,
Mm-hmm.
and you get a sample
Okay,
of that?
okay. Let's. If this were a thread on Facebook, let's say 1 second away. I already said her answer was right to cough. So that is the right answer.
But also, that's the right answer, yes. But
That's the right answer. So nothing else than that. You put a swab here, throat. That's gonna be a throat specimen, or no specimen. Again, it's okay. At least she's trying to find out what is the right answer. So don't be afraid, by the way, to ask questions. How silly the question is, it's fine with me.
sorry for my stupid question.
It's okay. That's life. The more you get
The more
asked
I
two stupid
ask.
questions, the more I will come up with the right answer, right?
Yes.
That's my role. But do not misunderstand, because some people think I'm arrogant because I'm a medical doctor. I think I'm way above everyone. No, I'm not. I'm just here to help you. Because I don't want you to be in a situation where you get to do stupid things, right? Right? A throat swab and nose swab will not help, because the problem is in the lung. You must cough. But the patient knows can the patient know what's the difference between spit and coughing? Sometimes they don't. So just telling them, hey, you need to cough. You have to demonstrate, ma'am, I want you to give me a sputum specimen, I need you to do this, ma'am. Good thing I have a cough right now. Cover your mouth, ma'am. You understand? You understand?
Yes.
Okay? So sputum culture, my wife is a microbiologist, she works at Cedars-Sinai, we give the specimen to her, 1 day later we get the results. Heavy growth of Streptococcus pneumoniae, sensitive to ceftazidime, resistant to penicillin. Am I going to give penicillin? No, because the patient will die. Am I going to give ceftazidime, a third generation cephalosporin? Yes, I will, because the bacteria that was grown was sensitive to that drug. Resistant to penicillin, I will not give penicillin. Because what will penicillin do to the bacteria? Tickle, tickle, tickle. And if the bacteria could speak to you and would say, "You're stupid, Dr. Gammel. I am resistant to this drug. Why are you giving this drug to me?" You know what I mean? Okay? You only give it to sensitive bacterial organisms, right? Okay? So between the chest X-ray, they both help. But the one that will really determine the etiology would be what? The sputum CS. But the chest X-ray is designed, you do a chest X-ray upon admission. After 1 day, we can do a repeat chest X-ray. Can we see a difference there? Definitely we can. A chest X-ray with severe pneumonia and a severe X-ray with lessened pneumonic infiltrate. Wow, beautiful. Do you understand? Okay? So, the idea here now is, what's the difference between a sign and a symptom? A sign is what? Objective or subjective?
Subjective.
Objective. What about symptom?
Subjective.
So if I say I have knee pain, what is that?
Subjective.
Why? Why do you say it's subjective? Yes, you.
Because that's what the patient is telling you.
The patient is telling you, can you feel his pain?
No.
Can you verify his pain?
Maybe.
How can you verify when you don't even feel his pain, right?
If you touch it,
Okay, did I say touch? I just said, he said he has pain in his knee. Okay, so pain in the knee is what? Subjective. What about if the pain is, okay, if the patient says right knee redness? Okay, sign. Why is redness a sign? Huh?
You can see the redness.
Okay, who can see? The patient or you? The healthcare provider can verify and say, hey, there is redness of the knee. And what does redness of the knee tell you? Inflammation. The signs of cardinal signs of inflammation. Rubor, redness, calor, warm if you touch. Dolor, there is pain. Tumor, increase in size. But the point is that you were able to see the redness, and therefore you can say, hey, if there is redness at the knee, is this arthritis? Maybe. It could be gout, it could be osteoarthritis, depending on the age of the patient. You understand? Okay? What about chest pain? Is that subjective or objective? Subjective. Again, it is a symptom. It is not a sign, right? Because pain. Do you understand the difference? Now, in the stages, clinical stages, what is the definition of latent period versus prodromal period? What is latent? Yes! Okay, she wants to volunteer. Okay.
Isn't it the exposure to the first sign and symptom?
So the time of exposure to, let's say, a bacteria or virus,
Yeah.
and then the time to develop the first signs and symptoms, right? So that is latent period. So let's say today I'm coughing and you're all healthy. Tomorrow when you go to class, you start to cough. Is that latent period?
Yeah.
The time duration between exposure to my virus, which I want to share because I'm very generous, is for free, okay? And you come back tomorrow after 24 hours, you start to cough, then that is the first sign of manifestation of coughing, okay? On the other hand, latent, it's latent. What about prodromal period? The appearance of the first signs and symptoms, right? Okay? What is remission versus exacerbation? Yes? Anyway, let's give a chance to the lady on the right. Yes?
Remission is when there's
to a decrease in the severity of the signs and symptoms. What about exacerbation?
Increase in severity.
It's very common seen in patients with multiple sclerosis. Sometimes there is partial paralysis and they can't move, and then in their remission it's back to normal. Then after 2 months they're back to paralysis again. Remission versus exacerbation. What's the difference between acute and chronic?
Acute is sudden and short.
Sudden and short, and then the maximum intensity of the signs and symptoms. What is chronic? It can last for what? Months or years. For example, a patient with acute kidney failure, can that eventually become chronic kidney failure?
Yes.
Like me, for example, 4 years ago I had kidney stones. I had severe pain at the lumbar area. Now what happens if that stone keeps on recurring? Because I don't drink water. I still do not drink water, and if I have another stone, another stone, another stone, can that lead to chronic kidney disease?
Yes.
Will I eventually need a kidney transplant? Anybody who wants to volunteer their kidneys to me? Okay, all of you will not get an A, okay? I'm just joking. Okay, do you understand? Now, so we talked about etiology, we talked about the cost, we talked about stages, and of course, what is epidemiology? The study of what? The patterns and distribution of diseases. I used to teach a subject of epidemiology. Epi means upon, demo means people, ology means study. What is upon the people? What are they sick of? Example, malaria. Is malaria endemic in California? What is endemic? Native to a local region, for example. Do you see malaria here? What about in Thailand, Malaysia, Indonesia, the Philippines, South America? Why? Because there is a mosquito that transmits, which acts as a vector that transmits this malaria virus. Okay? So that's why there's none of that here. What is endemic here in California? It's called the West Nile virus. If you go camping and you are bitten by that mosquito that can transmit the West Nile virus, can you become infected? And you develop encephalitis, and then what? Seizure with meningitis. So when you go camping, be careful. Watch out for those mosquitoes. Bite them first before they bite you. Okay? Why? What's wrong? Don't you bite mosquitoes? Okay? Okay, now, what is epidemic? Rapid spread of the disease in a big area or region, right? What about in the pandemic? Global spread. So it's just not just one country involved, it could be other different countries in the world, right? So that's why we have to be aware of these, and how do we prevent that spread of this particular disease process, right? Okay? Now, levels of prevention. What is primary prevention, class? Are we still good? Are we still good? What is primary prevention? Yes? Altering the susceptibility to the disease or prevent exposure. Like, you know, if somebody is coughing and you want to avoid that person, try to avoid me, but that's why I have to get away from you. Don't go to a place where there's a lot of people because you can be infected, right? Especially if you're immunocompromised. What about immunization? What about secondary prevention? What is that? Early screening and diagnostic tests, like in patients with pap smears. What is the purpose of a pap smear? Detect for what? Cervical cancer. What about when you do your breast exam? Mammogram and breast exam. Is that another word of secondary prevention? Yes. What is tertiary prevention? Rehabilitation, right? To restore a disability. So anybody who wants to volunteer here? Wants to volunteer? Okay, you volunteer. Okay, please stand. Because you're the one in front, and maybe watch out for the... Okay? Are you an LVN?
No.
It's okay, that's good. It's even better. Okay, please stay here with there. Be careful with the camera, okay? Okay, what is your name?
Beverly?
Nurse Beverly. I am your patient. Dr. Gamo suffered a stroke. God forbid, I suffered a stroke. I am paralyzed on my left side of the body. I am hemiplegic. Which device would you offer me for rehabilitation, for being able to walk again with the device? You have a choice. A walker, so please keep quiet. I want you to think. A walker, a pair of crutches, or a cane.
How about an electric wheelchair?
An electric wheelchair. It's not part of the options. I'm already partially recovered and about to start walking. So I need to help me walk with the I'm paralyzed on the left of my body. And for you to do that, you need to help me with the gait belt, right? Okay, go ahead. Which one would you choose and why?
I'll choose this one.
Okay, go ahead. Okay, can you open the walker for me, please? Okay, so keep quiet, please. Keep quiet. Very good. Okay, so he has opted to use a walker. Okay, so when you use this device, it's called a gait belt, around the waist. Okay, when you hold the gait belt, it should be this way. Okay, look, look. Okay, downward, it might slip. It should be upward, right? Are we still good with the camera? Okay, go ahead. Okay. Okay, first things first. You want me to use the walker. Now, where will you stay? On my weak side or my strong side? Where will you stay?
On your weak side.
Why?
Because I need to be able to support.
If in case I fall. Very good. Give me 5. Good nurse. I will hire you right away for that question alone. Okay. Okay. So I'm paralyzed on the left side. You told me to use the walker, right? Okay. How do I use the walker now? It's not gosh. Okay.
Now I'm thinking you can't hold it on your left
Why?
because you have weakness on your left.
So can I hold this?
You can try, but you have to do your.
This looks funny, right? Because it's the wrong answer. Funny. Wrong answer.
So I should have picked the cane.
Okay. The answer is correct. Cane. Now give me the crutches. Can I use the pair of crutches?
No.
Give me the other one. Can I use a pair of crutches? Why not? Because the left side is paralyzed, it will just what? Wrong answer, wrong answer. Finally. You have 2 canes here, Beverly. Which one will you use? The quad cane or the single tip cane? And why? You see, I always ask the question what? Why?
More support.
Which one will you use, Beverly?
This one has more support.
Why? Because it has how many legs?
Quadrant 4.
What about this one?
1. It's a single.
Okay, very good. That is correct.
What's the name for that?
Okay, quad cane. Quad means 4.
What?
Quadriceps muscle. Come on over here, my dear. You give the right answers, you'll clear my weak side. Okay, quad cane is the correct answer, therefore. So, if I move the cane to the front, which do you think should, quiet please, which should I move first? The left leg or the right leg?
The left.
I move the cane forward. Which one will I use?
The right.
The right, okay, then?
Then the left.
Okay, left. I just sustained a skull fracture, traumatic brain injury, died. I'm now in heaven. And she just lose her license. The first answer was correct, but I asked second time around because I wanted to find out if she will change her answer, and she did. In life, you must take the right answer if you think it's right. Remember the first question I asked? Which one will move after? Who needs their support, my dear Beverly? The cane is in front of you, okay? Cane, okay, stay behind me. Look at this. Cane, who needs the support? The left leg or the right leg? So, cane, left leg, right leg. Cane, left leg, what?
The weak side.
Of course. What about the right? You came and you told me to move the foot. It's not gonna be, I don't need the cane. I'm okay. The first answer was correct, remember?
The left.
You said yes.
Left.
So cane,
And left.
left. So weak, support. Weak, support. Hold me. Okay, let's go. Cane, weak leg, strong leg. Cane, weak leg. Thank you so much. What school do you come from?
West Coast.
Oh, I love these West Coast nurses. They're so great. They're so smart. Let's give her a big hand. So the bottom line, therefore, is that this is part of the nursing exam. It's called common sense critical thinking. Is something you need to know about taking a nursing board exam. In fact, as I reviewed nurses for 8 years before I started teaching in West Coast, I realized many of them do not use critical thinking skills. That alone, the answer is very simple. It has to be a cane because I cannot use the walker because one hand is weak. I cannot. Now you see these people they're tying the hand on that. That's wrong. I'm not kidding. Some nurses tie the hand on a walker. Have you ever seen those nurses? They should be firing squad. Why are you tying the hand? So if the patient falls, the walker will be. And have you seen those walkers with tennis balls?
Yeah.
What is the tennis ball for? What game? Is that for walking? Was that tennis ball created for walking with the use of a walker? What do you think of this? It's called rubber tips. What is it going to do? Huh?
Provide
Friction so that it will what? Stop. What happens if you have a ball? You understand? What kind of ball do you use? Tennis ball, okay? Yes?
I have a question. So in the event that a patient falls, what does a nurse do?
Well, you have to do everything to support him so that he will not hit his head on the floor.
If it's heavy and a tiny nurse,
You have to lift weights, go to the gym. No, just kidding. So if you think you are not able to support, I would suggest you probably get somebody to assist you, two of you helping walk the patient. At 300 pounds and you're only 80 pounds. Both of you will die. The 300 pound will hit you, you can't. You know what I mean?
I mean, there's no like certain way to catch a patient in the event
But
of falling.
have you taken physics? So an 80 pound, can he lift a 300 pound? Maybe not. So if you think you are not, get somebody to replace you. That's my way of thinking, you know. Do not try to be a superwoman, you know. If you're 80, 90 pounds and your patient is so big and you're doing gait training, you can't do it. Especially with the kind of cane that you're trying to do. Unless there are two of you probably and the other guy's bigger than you, then that guy will be the one to help you. Okay? Understand? Yes?
What's the purpose of the belt?
The gait belt is for training purposes. To have control. So if she was strong enough, she could have supported me with the gait belt. Even if the answer was wrong. You know, when I said cane, instead of left, she put me the right, and then when I moved the left, I fell. But because she did the right thing in the first answer, she could have hold on to the gait belt and then I would have not fallen, but maybe she was not able to react right away. You see, that gait belt would have saved my life. But I'm already in heaven, so I'm just you understand what I mean? So that gait belt would have been a big help to me. Understand? Okay. Is that clear? Now, okay, in chapter 2 we talked about stress. And in the stress, in the general adaptation syndrome, what are the three stages? You have what? Alarm, which is the fright and flight. What is the second one? And adaptation or adaptation. What's the third one? Exhaustion. Exhaustion is when you're not able to go back to homeostasis, right? Fright and fright involves what? What are the organs? The hypothalamus, when exposed to stress, right? Releases what? And I think you studied the table where you have corticotropin releasing hormone, affects both sympathetic and then what? Okay, so here is your stress, affects the hypothalamus, releases CRH, affects sympathetic and adrenal medulla, correct? What do you release? The catecholamines, right? Which is your epinephrine and? Okay, on the other hand, what does cortical releasing hormone affect what organ? Adrenal cortex releases what? Cortisol and aldosterone. Okay? These are all what? Steroid hormones from the adrenal cortex. So these are involved in the GAS. What does GAS mean? General Adaptation Syndrome by Selye, right? S-E-L-Y-E. Anyway, sympathetic response. Remember I said, first, alarm. Second, resistance or adaptation. The third is what? Exhaustion. Sympathetic response is for survival. Your pupils will what? Sympathetic causes you to dilate so you can see where the fire exit would be. What about the airways? Bronchodilate, open up the airways. What about the heart? Increase heart rate so that you can pump blood where? To the leg muscles, to the brain, the heart and the lungs, vital organs. You can what? Survive. You can run away from the burning building. You want to be able to think well. If you are on the second floor, are you going to use the elevator or the stairs? Stairs. But you need more blood to your brain to think clearly. Okay? If you have a laptop, are you going to look for that laptop?
No.
Leave it there. Duh. Okay. Do you understand? Okay? Now, in the third chapter, the most important chapter, actually I'm just looking at the study guide, right? We talked about the importance of cell injury. Some of them are reversible, some are irreversible, right? Let's first talk about reversible injury. What exactly do you mean by hydropic swelling? The cell. Remember the sodium-potassium pump? The sodium-potassium pump is what kind of pump? Sodium-potassium pump. Active transport. So it means it moves from low to high, right? Where do you find more sodium? Outside or inside the cell?
Inside.
Huh? Outside, my goodness. So from low to high, how many sodium?
3.
What about potassium?
2.
Opposite, right? From low to high. So
Potassium.
2 potassium in, put sodium out. Now the sodium-potassium pump requires what? Energy in the form of ATP. So you're going to throw sodium out, potassium in. What happens if there is, for example, the heart, this is the coronary arteries, coronary artery left and right. If there's a fat deposit here, what happens to the blood flow? Less blood flow. Is that going to lead to ischemia?
Yes.
And when there is ischemia, will there be decreased blood?
Yes.
Decreased oxygen?
Yes.
Do you need oxygen to manufacture ATP?
Yes.
Yes, you do, plus glucose in the mitochondria. Without oxygen, what happens to the amount of ATP? Decrease oxygen, decrease ATP, will the pump malfunction?
Yes.
It will. In other words, will you be able to pump out sodium?
No.
The sodium remains where?
Inside.
Inside. Now remember to say, wherever sodium goes, water will? So sodium will follow, water will follow, and the water will go inside the cell will become swollen. What does hydro mean?
Water.
Hydropic swelling. See? It's always a game of words. Why did the water go in? Because the sodium remained inside the cell. So wherever sodium is, water will follow. Yes, ma'am?
Sorry, I missed with the 2 and 3. What is that?
Oh, this is the amount of sodium atoms brought out.
So 3 sodiums out, 2 potassium in.
We learned that in physiology, right?
Yeah.
3 sodium out, 2 in of potassium. That's always the reason why you would always find more sodium outside than inside the cell. Is that clear?
Yeah.
Okay? Now, aside from hydropic swelling, another reversible is what? Intracellular what? Accumulation. If there's something wrong with the enzymatic reactions. What are examples of irreversible injury?
Necrosis.
Necrosis. Now there are 4 types of necrosis. What are the first 4 types? Huh? Okay, what does coagulative mean? What does coagulate mean? Huh? A clot. Example, if you have a blood clot here, right? The blood clot will completely block the flow of blood. This area will what? What is necrosis? Death. This will die. What caused the death of the muscle tissue there? A blood clot in the coronary arteries. Is that coagulative necrosis?
Yes.
Coagulate, a clot caused the death. What about the other one? Okay, liquefactive is what? The effect of hydrolytic enzyme causing abscess formation, like a brain abscess perhaps, right? What about the third one? Fat. Okay. Example, when you have hemorrhagic pancreatitis, the pancreas secretes pancreatic enzymes like lipase. What does lipase do? Digest what?
Lipids.
Lipids or fat. All the fats that will be digested, you will die. What causes you to develop hemorrhagic pancreatitis? Excessive intake of alcohol. If you want to die early, drink a lot of alcohol. Most of these people die in their sleep. When you drinking binge, so always drink with moderation. If you have excess alcohol, you give it to me, I will sell it to you, we will share the profit. Drinking is social, it's fine. Too much drinking is bad for your liver, and you might also develop this because of hemorrhagic pancreatitis. I'll see you in heaven because I'm already ahead of you. What's the fourth one? Cessation necrosis, it is seen in what? Tuberculosis of the lung. Like tuberculosis of the lung. Do you understand? Okay? So the bottom line, therefore, now we talked about what's the difference between hypertrophy and atrophy. Hypertrophy, there is what? Increase in the size of the organ, but the number of cells remains the same. Let's say there's 5, there will be 5, but increase in the size of the cell and the organ itself. What about atrophy? Same number of cells, 5, but decrease in the size. What is hyperplasia? Increase in number of cells. What about metaplasia? From one type of cell to another, conversion to another type of cell. What about dysplasia? Disorganized growth. Now why is that dangerous? What does it lead to?
Cancer.
It's pre-neoplastic. What do you mean by pre-neoplastic? It will eventually lead to cancer. Like example, we do a pap smear and the pathologist will tell Dr. Gamo, your patient has manifested with cervical dysplasia. Bad or good? Bad. Because it may lead to cervical cancer, right? So in other words, what we're trying to say, therefore, in patients with cervical dysplasia, when you do a pap smear, that will eventually may lead to the development of what? Cervical cancer among these women. Do you understand? Okay? Now, how do you differentiate benign versus malignant growth? Which one will metastasize? Which one is surrounded by a capsule? Which one is not going to metastasize? Which one will kill you? If they can spread. How do cancer cells spread? Number one, hematogenous. What is hema? Blood circulation. Lymphatic spread. A woman with breast cancer, can it spread to the lymphatic vessels and the lymph nodes in the axilla? Yes. That automatically becomes stage 2, right? Remember, staging based on what? Tumor, node involvement, and metastasis. TNM, right? Right? Remember that? So that's very important.
What did you say about Estella? Sorry. What did you say about Estella?
What is it?
Axillary lymph nodes.
Oh, axillary lymph nodes. That's the axilla is the armpit. Okay.
Or if someone has a...
If the moment it has spread to the axillary lymph node, it's automatically stage 2.
Right.
Remember we do staging, T and M. T, size of tumor, and node involvement, M, metastasis to other organs. Can it spread to the lungs? Yes. Okay. Now men, what is the most common cause of cancer in men? Prostate cancer. How do you check for prostate cancer? Okay, what's her name? The one who wants to go to the Friday class. What did you do? Is that the dirty finger? She goes like this. Why did you show me that dirty? Okay. I know. So you do a what we call DRE, digital rectal exam. Is this a digit? Okay. I usually use 2 fingers with gloves and KY. Why do I use KY? Lubrication. Is it going to be painful to insert your finger into the anus of a man?
Yes.
My first experience, oh my God, my virgin anus. Very painful. And my doctor was not even telling me ahead of time. She goes, I was teaching at UCLA and she was a graduate of UCLA. Oh, Dr. Gama, when have you been teaching? I'm like, okay, bam, bam. Oh my God, it was so painful. And she goes, oh, don't worry, Dr. Gama, your prostate is not enlarged. I almost cried, but I was so afraid to cry in front of her. Thank you for the KY, the KY help. I always carry a KY with me everywhere I go. Okay. What about PSA? What is PSA? Prostate specific antigen. A blood examination is elevated. I may have developed prostate cancer, right? Now, cancer, can it cause malnutrition and cachexia among patients?
Yes.
Have you seen that picture of the cachexic woke man? Looked like me when 20 years ago, skin and bones. I did not have cancer, but I was just reviewing for the medical board exam when I was still in the Philippines. Oh my God, I was like a Auschwitz prisoner of war. When I saw that picture, it reminded me of myself. Not because of cancer, but it could be something like that, right? Why do they develop that? Because cancer cells, they love to eat. they're very greedy. If they can only speak, because why? They grow a lot. To be able to sustain their growth, they have to have a lot of nutritional support, and not only that, a lot of blood vessels are used. Whenever we do cancer surgery, remember cancer treatment, chemotherapy to prevent spread with the use of chemical agents, we need to understand that when we do cancer surgery, there's a lot of blood, because why? The tumor has a lot of blood vessels in order to sustain their growth. Do you understand? Okay? Okay, I'll give you a short 5-minute break. Go to the restroom, release the bladder, then you come back, and we will have the quiz, okay?